Reactive arthritis is basically, it's another name for it, it's called Reiter syndrome. And it's a painful form of inflammatory arthritis that develops as a reaction to systemic infection with bacteria or virus, usually of GI or GU origin. Now, listen to me. The joint itself is not infected. So see, when you do that whole joint aspirate in reactive arthritis, you will not get the whole pus-filled blah, blah, blah. There will be no bacteria in the joint, right? The infection is somewhere else. There's a reaction to the infection in your body, the systemic infection that you have, that causes an inflammation of the joint, okay? So we talked about strep pyogenes, strep throat, okay, or also called rheumatic fever, right? Strep throat infection, glandular fever, EBV, viral flu, food poisoning with like Campylobacter, Salmonella, Shigella, Yersinia, or others, sexually transmitted infections or diseases like chlamydia, gonorrhea. If you have one of these infections in your in your body, you can have a flare of your joint, and that can cause you to have a hot swollen joint, okay? And cause you to have a hot swollen joint, right? So signs and symptoms, again, exactly the same as before. Hot swollen joint, reluctant to move, unable to bear, severe pain, systemic features, right? And how do these present? Can't see, can't pee, can't climb up a tree, okay? So you get conjunctivitis, can't see, urethritis, can't pee, arthritis, can't climb up a tree. I learned can't climb up a tree, but they've put can't bend the knee. And the other classic feature is something called keratoderma bleneragica. Oh my God, this is such a loved exam question. Man comes in, had a swollen joint a week ago, has this lesion on his feet, hard, kind of scaly skin. What is it? Keratoderma bleneragica. What did he have? He had Reiter syndrome. He had reactive arthritis, okay? So that's basically the classic signs and features. Investigation is much the same. However, remember, they have systemic infection. So you need to check the GI for stool cultures and abdominal x-rays. You need to check the GU. So you need to do an examination of the genital areas. You need to do a urine analysis. You need to do swabs to check for any STIs or STDs. You also can do a genetic test for HLA-B27, but you don't tend to do this. HLA-B27 is a classic feature of reactive arthritis, as well as psoriatic arthritis as well, okay? So those are the kind of special tests that you do on top of your normal bloods and joint aspirate, okay? Investigations, we talked about this already. So treat the underlying cause. That's what you want to do mainly, okay? It should say management, really. Treat the underlying cause. So you want to give antibiotics or antiviral, depending on whatever the underlying cause is. And then you do symptomatic management. So analgesia, antipyrexials, and stuff like that, okay?